The medical charity Doctors Without Borders is warning that measles is surging across Sudan's Darfur region, with more than 1,300 cases recorded since September alone. This comes as the UN warns Sudan's civil war is entering a deadlier phase. Territorial lines are shifting rapidly. The paramilitary Rapid Support Forces now controls most of Darfur to the west, while fighting has intensified in the Kordofan region to the south, which remains a flashpoint between the RSF and government forces. With the collapse of vaccination programs, aid agencies say bureaucratic barriers and active fighting are leaving millions of children vulnerable to diseases that should not be life-threatening. For more on this, we can speak to Joyce Bakker in Darfur. She's an emergency medical coordinator with Doctors Without Borders. Thank you so much for your time today, Joyce. Now, measles is preventable, yet it's surging. Just tell us, why is this disease proving so much more lethal in Sudan right now compared to other conflict zones?
Yeah, so thank you very much for inviting me here. I'm Joyce, I'm the medical coordinator in South Darfur. As Medicine Sans Frontières, we are here in Darfur since the start of the war, supporting the hospitals. And what we see is that measles cases have been around in Darfur throughout the year. But recently, since the beginning of November, the cases are rising very rapidly. We have MOH reported over 2,000 cases recently, and hundreds of cases have been admitted in our measles isolation ward. And very concerning is that what we see is that 40% of the children are malnourished. And what we know is that malnutrition weakens the immune system and makes the children very vulnerable to measles with the deadly complications. At the same time, we know that measles is weaken the immune system and also makes children more vulnerable to malnutrition. So the conflict in Darfur has led to widespread displacement, severe food insecurity, and even the famine in some regions. And the fragile healthcare system prior to the war has been collapsed and urgently need to be restored.
Joyce, there's I understand as well, there are problems getting vaccines across battle lines to the children in need. Just help us understand this, if you could.
Yeah, it's quite a complex system. So there is really an urgent need to start immediate measles vaccination campaign across Darfur. And it has been very challenging to get the vaccines and consumables, the medical consumables, cross-border, cross-frontline into the Darfur state.
Joyce, help us understand what the long-term health impacts will be on children right now if a truce isn't reached and this conflict is somehow brought to some kind of ceasefire or an end.
Yeah, for children growing up during a war will have lifelong consequences. So growing up with uncertainty, losing their loved ones or even their parents, school education has been interrupted. Also, we know malnutrition in young children leads to irreversible damage to physical development, but also cognitive and mental health impact.
Joyce Bakker with Doctors Without Borders in Darfur, we really appreciate your time today. Thank you so much and all the best.
Thank you.